Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic is our podcast today is Staph aureus. Is Staphylococcus aureus a bacterium?
It certainly is. And it's called a facultative anaerobe, which means it can grow without oxygen. And it's named for its appearance under the microscope. I'm going to show you our book here. And let's see if I got it in the right spot there. Good. That's our book. Anyway, thank you.
Is Staphylococcus aureus common?
Actually, yes, about 50% of people carry it in their noses or respiratory tract and skin. 20% carry it all the time, and 30% carry it some of the time.
How many kinds of S. aureus are there?
There are actually just two. There's the methicillin-sensitive Staph aureus, and then there's the methicillin-resistant Staph aureus.
What is the difference between MSSA and MRSA?
MSSA is like I said, methicillin sensitive, easier to treat. Almost any penicillin works. There are probably four kinds. Vancomycin, though, is the first treatment for MRSA. And MRSA is sometimes called the eating staph, and it is a mostly hospital acquired organism.
Can either kind be found commonly in contact sports like wrestling?
Unfortunately, yes. I've had in some of my practices a lot of high school students who come to me with a pimple, and I'm supposed to try to figure out what kind of staph it is. But again, it can be contacted by direct contact between people and articles of clothing, mats, door handles, faucets, telephone, keyboards.
What are the common physical findings for S. aureus infection?
There's certainly many bacteria, draining sinus tracts, redness of the skin, fever, swelling, pain, abscesses, boils, warmth, and toxic shock syndrome, which presents as a petechia. We don't see that very much anymore, thank goodness. There's endocarditis, which is an infection in the inside of the heart, sometimes associated with murmur, pneumonia, meningitis, osteomyelitis, which is an infection of the bones, and sepsis.
How common are S. aureus infections?
Each year, there's about 500,000 hospital patients in the United States. Up to 20,000 deaths each year are linked to this. MRSA, the MRSA, is a worldwide problem in clinical medicine, and the deaths from Staph aureus exceed those caused by HIV, AIDS, Parkinson's, homicide, and it's estimated that we spend about $32 billion a year on these things.
What tests will your doctor order?
Complete blood count, liver, kidney studies, electrolyte, blood cultures. Prior to the 1940s, Staph aureus was almost universally fatal. About 80% of the people died. Then we got penicillin, and that worked until the end of the 40s.
All right. What number are we on, Doc?
Number 9.
Number 9. What antibiotics are used to treat S. aureus?
For the MSSA, penicillin like nafcillin, amoxicillin, dicloxacillin are useful. For MRSA, MRSA, penicillin is not effective. Vancomycin is the go-to drug of choice, and that works unless you're allergic to it.
Who is at the highest risk for MRSA infections?
People older than 65, urinary catheters, previous antibiotic treatment in the last 3 months, trauma, long-term care, and joint replacements are very high risk for septic arthritis, endocarditis, which is an infection in the inside of the heart, and pneumonia.
Is there a vaccine for S. aureus?
No, they've been thinking about it and trying to make one, but nothing has been approved yet.
What percentage of human population are long-term carriers of S. aureus?
Somewhere between, like I said, 21% are long-term carriers, 30% are intermittent carriers, and they can be found in normal people, in nostrils, and also in the lower genital tract sometimes.
Can SRAS cause food poisoning?
Yes, it can. Incubation period lasts 30 minutes to 8 hours, so not everybody needs treatment. Illness can last 30 minutes to 3 days. Preventive measures include hand washing with soap and water before preparing food, and also food should be stored below 40 degrees Fahrenheit or over 140.
What are the common conditions associated with SRAS infection?
Blood infections with these things are common in people who have cancer, chemical burns, electrical burns, thermal burns, lung abscesses, fever, and unknown or fevers without any obvious reason, that is, without a focus, hospital-acquired infections, and even ingrown toenails or fingernails, sinus infections, and food poisoning.
All right, the best place to go is world.allen.com and pick up what see the book. Doc,
Oh, you
pick
got it.
up
That's right there.
Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast, guys. Take